story highlights Ebola, SARS and Zika also made the WHO 2018 list. WHO's plan is intended to accelerate R&D during international health emergencies. CNN. The World Health Organization included Disease X in its most recent global plan for accelerating research and development during health emergencies like the Ebola, SARS or Zika epidemics. The Strategy and Preparedness Plan, known as the 2018 R&D Blueprint, was published last month. So what, exactly, is Disease X? This enigmatic name represents the knowledge that a serious international epidemic could be caused by a pathogen currently unknown to cause human disease, according to the WHO. As experience has taught us more often than not, the thing that is gonna hit us is something that we did not anticipate, said Drive. Anthony Fauci, director of the U.S. National Institute of Allergy and Infectious Diseases. Just the way we didn't anticipate Zika, we didn't think there would be an Ebola that would hit cities. X stands for unexpected, he said. Read more. When confronted with the unknown, the WHO recognizes that it must nimbly move and that this involves creating platform technologies, explained Fauci. Essentially, scientists develop customizable recipes for creating vaccines. Then, when an outbreak happens, they can sequence the unique genetics of the virus causing the disease and plug the correct sequence into the already developed platform to create a new vaccine. At least 78 dead in Lassa fever outbreak in Nigeria. Fauci said that to develop these platforms, scientists must first study entire classes of viruses, such as the flaviviruses, which include Japanese encephalitis, yellow fever, Zika, and West Nile virus. If you develop an understanding of the commonalities of those, you can respond more rapidly, he said. Along with Disease X, the WHO names 7 other potential global disease threats, each lacking an effective drug or vaccine. They are Crimean Congo hemorrhagic fever, CCHF, Ebola virus disease and Marburg virus disease, Lassa fever, Middle East respiratory syndrome, coronavirus, MERS-CoV, and severe acute respiratory syndrome, SARS, Nipah and Henipah viral diseases, Rift Valley fever, RVF, and Zika. Deadly Marburg virus outbreak declared in Uganda. The R&D blueprint was born as a result of the Ebola emergency in West Africa, which began in March 2014, explained Marie-Paul Keeney, former Assistant Director General of Health Systems and Innovation at WHO, in a statement. Keeney, who led the WHO research and development effort during the Ebola outbreak, said this international emergency taught scientists that research and development needs to be an integral part of the response to epidemics. The 2014 to 2016 outbreak, the largest since the virus was first discovered in 1976, included a total of 28,616 confirmed, probable and suspected cases and 11,310 deaths in Guinea, Liberia, and Sierra Leone, according to WHO. Follow CNN Health on Facebook and Twitter. See the latest news and share your comments with CNN Health on Facebook and Twitter. WHO's work alongside governments, scientists and private entities resulted in the first ever fully effective vaccine against Ebola, developed and tested in 12 months as opposed to the 5 to 10 years such a process would normally take, said Keeney, who welcomed the opportunity to use her Ebola experience to prepare for future health emergencies.